Hello, my name is Shelly Lynn Hughes, and I am the founder of Pursuit 365. I'm also the host of Talk Wednesday, which I bring an incredible guest on every Wednesday and learn all about them and what they're doing in the world. So today, I'd like to welcome Dr. Kristy King, and I'll give you a little info about her. So, Kristy King is a medical doctor with a special interest in integrative and lifestyle medicine. In her practice, she focuses on the whole person, uniting the best of conventional medicine with nutrition, movement, and other mind, body, spirit disciplines to support your unique balance and innate capacity to heal. She completed her medical residency at a University of Washington program in Chehalis, Washington, and her fellowship in integrative medicine at the University of Arizona Center for Integrative Medicine. She has advanced training in somatic movement, yoga, breath work, nutrition, integrative psychiatry, and functional medicine. Wow, Dr. King, that is absolutely amazing. I love what you're doing. Welcome to Pursuit 365's Talk Wednesday.
Thanks so much, Shelly. It's awesome to be here.
It is so nice to finally connect with you. I know you and I've connected through LinkedIn, and you became part of our community like 6 months or a year ago. I don't even know now, but we've never actually got to meet over in person or even through video chat. So excited to meet you.
I'm excited too. Thank you for having me.
Oh, so great. So where are you today? So I know are you dual citizenship because you're here in Canada, right? Today?
Yes, I am.
So you're in Canada today, but then you do your practice in Washington.
I do. I practice with Seattle Functional Health currently.
Wonderful, wonderful. So how many days a week do you go back?
3 days a week, but it's mostly virtual. So.
Oh, okay. Got it. I understand. Okay. So I've got a few questions I want to ask you that I wrote down, and we just want to know more about you. So you were in naturopathic medical school prior to switching conventional medicine. Why did you make the switch? There's, naturopaths, traditional, they practice very differently, but there's a reason why you made the switch.
Yes, there is. Well, I think both modalities and both paradigms are very important for health and healing. And I think that our patients really want physicians who understand both worlds and can integrate the best of naturopathic medicine with conventional medicine. So I realized that that my role in the healthcare system would be as a bridge.
And I love that. I love that so much because I'm just going to lift up my dog here so he doesn't drive us crazy. I love that so much because I know for myself and, coming from the natural health food industry and coming from a fitness industry, I know that there was times when I needed, your traditional doctor over, and other times I needed my naturopathic doctor. So to have someone like you that is the bridge that gets both sides of it, I'd say that's fairly rare because generally it's one side or the other, correct?
Correct. And it's a lot of education, but I think it's important. And I hope in the future that we have medical schools that really help combine the best of both worlds.
Yeah. And definitely all that education. I mean, that's years and years and years.
Yes.
Yeah. And so do you ever hear from one side or the other that, the negative side of it? Does anyone ever say, oh, why do you do this? Or do you don't care? You're just like, you know what, I'm doing what I'm doing.
Well, I think the most important rule in being a physician, having the privilege of serving as a physician, is to meet patients where they are. And so I learned very quickly from talking to my patients, what's important to them and how they feel comfortable addressing their health. And sometimes that's solely with conventional practices, and sometimes patients are looking for, a different approach. And at least with my education and training, I'm able to tailor to their desires and needs.
So I'm curious, kind of going again and extended from the last question, does the healthcare system actually support you in this approach, or do you think?
No, and that's a very unfortunate reality. Particularly in Canada, I think because we have such a healthcare shortage, the physicians are really strapped for time. And the way the system is structured is that all we're really doing is providing Band-Aid healthcare, and it's not really a healthcare system, it's a disease management system. And, in order to really get root cause medicine, our patients need to seek elsewhere.
Yeah, and I can see that completely, especially in the Canadian system. You're in, you're out. There's not really, we're not focusing on prevention, really. Even I have friends of mine that are quite surprised that I generally will go to my naturopath first, and then, unless it's an actual quick emergency, I'll go to my GP, but I'll do my naturopath first, and I do a lot of preventative medicine so that I don't have all the problems later. Do you find, since you've been doing this for so long now, that a lot more people are having that same approach as I am?
Yes, I do. Yes. And I'm so excited to see that trend in Canada, with patients feeling more empowered to take control of their own health and wellness, right? Because this sort of codependent relationship that some patients have with the healthcare system, I think, giving their power away to the healthcare system and believing that there's something external to themselves that they need to be whole, is the wrong direction in general. I think the more we can empower our patients, and for people to feel empowered to really take control of their own health, is positive.
So I'm just going to say it right now. We need more doctors like you on both sides.
Yeah.
I'm not saying the naturopaths is perfect, and I'm not saying GPs are perfect, but I will say your approach for me is so empowering as a patient, so that someone that will take a look at, the natural side of things, and just prevention, but also understanding, there's some times where we actually need to go to a GP, or we need emergency. It's not that, right? So I love your approach. Now, this is something that I know a little bit about, coming from the health industry, but not too much. But what's functional medicine? That is one of your specialties. So tell me, and tell our our watchers, what functional medicine is.
Absolutely. So it's essentially root cause medicine. I think of it as just being good medicine, because, say, for example, if you came into my clinic and said, Kristy, I have fatigue, or I'm not sleeping well, I'm not going to give you a tranquilizer for sleep and give you, I don't know, a stimulant for your fatigue, right? I'm going to uncover the root cause and see if you have a vitamin deficiency, or if maybe your hormones are out of balance, and that way, and try to support the body to mimic its natural capacity to regulate itself. I mean, we live in a world where there's so much stress and so many external factors. We really need to help you regulate your neuroendocrine system, and there's ways to support that don't involve like putting Band-Aids at the bottom of the cascade, which I feel like we do a lot in conventional medicine.
So not a ton of pharmaceuticals, and let's work at why.
Right. Right. I mean, putting a pharmaceutical, I mean, it's like mopping up the floor while keeping the faucet running, doesn't make a lot of sense. We need to ask, why is there all this water on the floor?
So, I think of you working in the United States, your practice in the US, and then knowing the difference between the Canadian and American health systems. When my American friends are like, "Oh, you're so lucky, you have free healthcare." You have free healthcare, but you, on the other hand, even though we have free healthcare, you're saying that there's not a lot. Don't mind me, I've got my chihuahua here. There is a difference. Yes, sweetheart. Yes. There is a difference from what you can and cannot do in Canada. So even though a lot of our American friends are saying, well, you have free healthcare. Yeah. In your mind, would you say there's pros and cons to both sides of it, and what you're allowed to practice?
Absolutely. And like you pointed out earlier, for emergency health services, we are so fortunate in Canada that we're able to walk into an emergency room and get emergency health care, and not have to mortgage have to put a second mortgage on our house, or be left with a huge bill that is really just messes up our whole lives sometimes. So in that regard, we're very fortunate in Canada. Excuse me. Sorry about that.
No problem.
Um,
We all have lives. It's okay.
but on the other hand, because we're trying to provide basic healthcare services to so many people, kind of on a budget,
Yeah.
we only can provide limited healthcare services, and unfortunately, what makes the cut is very conventional medicine and not root cause medicine.
Okay. Okay. So, yeah, like I heard, I don't know if this is correct. Again, when I had my two babies, it was all covered, but the US, I heard it's like 20 or $30,000 if you have no insurance to have a baby.
Yeah,
Oh my goodness.
yeah.
That's just insane.
It really is. It's a totally different system, right? Healthcare is not seen as a human right, and
Mhm.
we all have different perspectives on this. I think it's really a lovely place in Canada where we have access to healthcare when we need it.
Yeah, for sure. The other, I was watching a documentary a few years ago, and I think it was, what was it, Michael? I don't remember Michael, the one who's a controversial documentary
Yes,
gentleman. I don't
Michael
remember
Moore.
his name. What's his name?
Michael Moore.
Yes, yes, yes. But I watched one on the healthcare systems. Did you see that one?
Yes.
And I was actually quite shocked that didn't Cuba come out on top? Do you know much about it?
I can't remember. That was
Yeah, Cuba came out on top. Like I was looking at my daughter's EpiPens
Mhm.
and her asthma medication, and in Cuba, it's like $5 or $10 for these two medicines. Whereas here in Canada, I'm self-employed. I don't have, extended medical. So for me, an EpiPen's $125 or $135. Whereas like, oh, well, but then again, I've got some friends, they've got their extended medical. They pay, I think, $20 or $25 for an EpiPen. But like in Cuba, it's like $5 or $10.
Yeah,
But
that's
a
right.
huge difference. And you can get in all the time.
Totally. Yeah, it's very interesting what different countries have done in order to serve their population. So
It's very different. It's different. Okay. So what do you see in the future for healthcare and in medicine? So and let's talk about you because you are Canadian and you are, also are you working in the US.
Mhm.
So what do you see that's up and coming, exciting, maybe not exciting? Like what do you see happening? Because I mean, I'm sure you see both.
Well, I'm really excited about a paradigm shift. Um,
Okay.
and that's towards more of a regenerative health paradigm. I think we have used a reductionistic mindset to
Mm-hmm.
study medicine. And even though, functional medicine is looking at the root cause of fatigue and whatever, and really getting into that, it's still the same way of thinking. Where the body is a sum of its parts. And I'm really excited about moving towards looking at our bodies as being these dynamic, energetic temples, right? And really empowering people to retrieve their innate wisdom and able to, have more control over their physiology. Because I believe as human beings, we really do have that capacity. We've just sort of given our power away.
Absolutely.
I know that might be a little, out there, but I think that the more community healing opportunities that we create for ourselves, as far as I'm seeing that a lot in women's circles and women's groups coming together and really facilitating healing for one another. I think the power of the authentic, vulnerable human connection really needs to be harnessed.
Mhm.
And finding more ways to create those opportunities for patients is really what I'm interested in.
Yeah, that's very cool. And what about a negative? Do you have a negative or no? Are we only talking positive stuff today?
We can talk
I
about
don't mind hearing about the negative because I think it keeps us aware, right? Like it
yeah.
keeps us aware. But and then I guess sometimes like I guess you got to worry about what you're going to say.
It's I'm yeah, I'm okay speaking truth at this point because the healthcare system's not working. It's not working. In the United States, I think that to a certain degree, the insurance companies and the pharmaceutical industry are kind of going to start having disagreements, and that's going to be interesting to observe. And I think it might come to a head at some point in our lifetimes where it disintegrates and we have to rebuild it. And the rebuilding is very exciting.
For sure. Yeah, like even the natural health food industry right now, with them and what's going on with the natural health food, when you can't go to a health food store and pick up a package of vitamin C, or a bottle of vitamin C or a vitamin D or, iron. I mean, my only health issue that I have is I need my iron supplement. And most women do, but I'm anemic without it. I can't imagine not being able just to go to a health food store or a grocery store and pick this up. So that I find that extremely frightening.
Yes,
And
absolutely.
it's just not right.
No, no,
More
it's
Canadians need to be fighting for this. Like, I
yeah,
don't understand why more Canadians aren't fighting to have that, for our rights. But
absolutely. And if I could empower, encourage all Canadians to really stand up for what they want in the healthcare system, right? Because what I hear from my Canadian patients is like, we want more of this. We want a holistic approach to our healthcare, and unfortunately, because of all the politics around it and the pharmaceutical influence, it's really hard to make those changes. But I think it really has to come from our patients. So I'm here to support and encourage and fire it up.
exactly. And then the other side of it, and I'm not going to get into this because I don't need the negative feedback, but and I'm sure you don't either, but the other thing is being forced to put stuff in us, and everyone should be afraid of that. Like, at some point when we need to, I don't know. I find that disturbing as well for everybody, being forced. I think that's very scary too. And again, I'm not going to get it. We don't need to get into that, but I think everyone needs to think about that.
Absolutely. And again, it just comes down to, we really need to feel empowered to control our bodies and feel confident that we can.
Oh, definitely. And the one thing that you did say was that now it's changing, like with women supporting women more in healthcare and whatnot. I also noticed there's a shift with teenagers these days, like what my 17-year-old daughter, what her and her friends talk about. Like, I can't even imagine what she talks about with me when I was a kid. There's no way I'd talk about this stuff with my mother. But I love the fact that my daughter comes to me about anything and asks questions. Or her and her friends talk about it, or they come to me and ask me. And I can't imagine doing it with my mom, even though my mom and I are super close now. But I think this, and I don't know if you're going to agree with me on this or not, but do you notice, like I've noticed that the younger generations are more open to be talking about everything?
Yes, they are. And I think, yeah, absolutely. They have to be, right. They're facing some significant challenges in their lifetimes, and we really need to empower our young people to,
Mhm.
to stand up and speak their truth and not feel like there's going to be some consequences for being who they authentically are. I think
Mhm.
in general, there's an authenticity crisis that's happening, and we see that manifest as mental health illness in adolescence. And I have such a big aversion to the way we put our adolescents in containers, put a stamp on them, and almost create more problems for them, as opposed to empowering them to really be who they authentically are. So,
Well, and that's a big thing right now is the mental health, anxiety issues. I mean, I don't know how many times gotten bigger and bigger since we were kids. It's a pandemic now, and I don't know what we're going to do to change that. Do you have any ideas? Because I'm at a loss.
yeah, well, I think this idea that neurodiversity is somehow dysfunctional needs to be transformed, like that way of thinking.
Yes. And strangely enough, my 17-year-old really does educate me on that quite a bit.
Yeah, absolutely. I think we need to listen more and stop imposing our own, paradigm onto how they're presenting to us, right? Because they're coming into this world with different ideas and different way of thinking, and I'll call it neurodiversity that
Definitely.
maybe doesn't fit into our containers, and that's okay, right? I don't know if you've seen the X-Men, the school, the Xavier School in X-Men for the gifted children. or the
No,
quote
but
mutant children.
oh yeah, no, for sure.
I kind of think
Well,
of it.
just like you and I were discussing earlier about my daughter, like she doesn't, the older one, she doesn't fit in
Yeah,
to that typical school, right?
that's
Her
right.
brain just doesn't think that way. And I'm so accepting of it, like, okay, let's figure out what works for you because we are all not in the same box.
That's right.
And
Exactly.
that's okay. There's nothing wrong with that, but let's find out what does work.
That's totally exactly. And I think, putting the dysfunction of society on the individual is really not okay either, right? For us to feel dysfunctional in a dysfunctional society is normal. I mean, in my opinion. So, so
No,
it's like,
I totally feel that same way.
mhm,
Uh, I feel that exact same way.
yeah,
And again, like I said, my older one really teaches me um, a lot, right? Like, mom, this is why, this is not why, this is why I can do this, this is why I can't. And instead of saying, oh damn it, just go do it. Geez, like, come on, get over it. Now I sit back and I have to listen. And I think if we stop and listen, and like I said, find other pathways, like what you're saying, then we can all heal and be healthier and society will be better, community will be better.
yeah,
For
absolutely.
sure, for sure.
Yeah.
Okay, so tell me, with let's just say someone's watching this program and they've got something happening that say they've been to their doctor 100 times over, doctor is not listening or not understanding or cannot figure it out. Okay, so let's face it. I mean, I had a tumor, a parotid tumor here years ago, and it
Mhm.
took 3 years for them to find it, and then I ended up having surgery and taken out. And this is many years ago, by the way. So, but it took a long time for, and I love my doctor, so I'm not saying anything bad about him, but it took a long time for us to figure out what's happening. So let's say someone's watching this and say they were in the same situation as me. The doc, I think we know when something's wrong. I know when something's wrong.
Yes, that's right. You do. You do. And it's a matter of like you feeling empowered to listen to that. Anyway, sorry, I didn't mean to interrupt you.
No. I want you to talk, but I know, like, when I know 100% something is wrong,
Yes.
but nobody can figure it out. Now, let's just say, and we're going to have a lot of people understanding what I'm saying. If I get a hold of Dr. Kristy King and I say, oh my gosh, what do we do? What would be your next steps? Like, what would you say to me?
Well,
How would we do the intake, or how would we move forward with it to find out?
yeah, I mean, the way I practice right now is we do, basic laboratory tests, not basic. When I say basic, I mean
Yeah,
lots more than you would get at your family
regular
doctor,
GP.
right? Yeah.
Yeah.
Which you like laboratory tests. But, the first step, in my opinion, is to really empower you to listen to your intuition and tell you, validate what you're experiencing, right? Because, I
Mhm.
mean, just for example, patients with mold toxicity present with very strange, set of symptoms, and they're labeled as sort of hysterical psychosomatic patients in the conventional healthcare system just because we don't understand. And I guess it insults our ego or something for us to not know how to help them. And
Mhm.
we tell them that's in their head and disregard what they're experiencing. And I think that's just really unfortunate because then those patients feel isolated. They feel like, they're not okay. They maybe they're, have a mental illness or, insert personal dysfunctional thing. um, and then they're scared to ask for help. So the first step is to validate what they're
Mhm.
experiencing, and then we just walk the path together. And that's another thing is I went to medical school, so I have the privilege of sitting in the canoe with my patients, and sometimes they row, sometimes I row, and we row together and we just figure it out. Um,
And
yeah.
let's just say let's say there's nothing wrong. Let's say they're in perfect health, right?
Hmm.
And let's say there wasn't wrong, but they'd keep coming back, right?
Yeah.
Then I guess, I mean, then I guess you look at the mental health side of it. Like, why is this patient still coming back when we know that there's something wrong with them? So then you can work on the mental health side of it, right?
Absolutely. Yes.
Mhm.
And mental health is so complicated, right? I mean, our minds are very powerful, right? We can we can control our bodies. I really believe that, right? Just so, yeah, we
I
can.
completely agree with you.
Yeah.
I completely, and for me, there's nothing worse than no one believing. You just want someone to validate, like what you said, like just hear me.
Yeah.
Just hear me.
Totally, Shelly. And what I was saying earlier, I also have learned this is the human connection and the relationship that I form with my patients is really where the magic and the healing comes from or through.
Absolutely. I could see that. I
Yeah.
could see that for sure. Yeah, because if you don't have that understanding, the compassion, and you're trying to heal, why would you go to someone that you don't have that with?
Yeah. We're so busy trying to apply our algorithms, like, and all these things that we forget about the human connection. And I think that's just so powerful.
So if they wanted to get a hold of you, now we're going to put this in. I still have one or two more questions, but we're going to put this all in the info session below this. But so if someone wanted to get a hold of you, they could connect you with your website, which will be inside there, and then someone will get back to them, and then you can do distance, like you can do video chats, you can do it from remotely, right?
Absolutely.
Okay, good. That's great. Now, what do you have? Two things. What do you have up and coming that's exciting? Like, do you do any speaking anywhere? Do you put on your own events? What do you have up and coming that people might want to know about?
Oh, thank you for asking. I am planning to start doing retreats. And like I said, this is basically creating more opportunities for patients to experience that connectedness. And, and what we're going to have, the retreats are going to be designed to help empower us and retrieve our innate capacity to heal our bodies. And of course, really the focus will be on self-care. So I'm excited to be organizing those. I think we're going to have our first one in Naramata, BC in March or April.
Oh, that's exciting. Will you do some in the US as well, or just Canada?
I'm not sure. I'm planning them in Canada right now. So we'll see how that goes and then go from there.
And will your retreats be 3 days, 2 days, a week? What are you thinking?
I'm thinking we're going to start with 3 days because I think that's easier for people to make work. So
Absolutely, 100%. Okay, this as a naturopathic doctor and a traditional medicine doctor, let's go with 5 tips that you could give that you could change your life right now and help heal and help live a healthier life all over. What are 5 tips from? This will be our end note.
Okay, end notes. Well, I would say, try to do some sort of grounding exercise every day, like dance. I really like to dance. I feel empowered when I dance. But do something, to really connect with your heart space. So whether that's breathing or dancing or whatever you do, going for a walk, nature is a portal to, elevated consciousness. And I would try to do something in nature. It's very cold. So I maybe we won't want to do that.
Really cold right now, like so cool.
So that's that. And then I would, obviously eat real food. I mean, this is so hard for us to do in our culture and society where most food products presented to us are not real food items. So I would just say eat real food, not too much, mostly plants. This is a Michael Pollan quote, but I totally agree with this approach. The lower we can eat on the food chain, the less toxins we're exposed to and the less neuroendocrine disruptors we ingest. And that's good. Number 3, let's see, hydrate. This is always a challenge, but hydrate every day. Yeah, water. Number 4, try to exercise. The evidence for exercise is critical. There's so much good evidence for exercise. I mean, we reduce our telomere length, which, prevents us from aging rapidly. Stress management, so many physiological benefits. Just overall, please exercise. And then number 5, let's see, connect with the people that you love. Find time in your day to connect with a friend or, sit down with your kids and really be present with them and feel that love and connection and that sense of belonging to that space and relationship.
I love all of those. Those are all amazing and all so important. Every single one of them. Yeah. Connection is so important, isn't it?
It's so important.
And this is partly the reason, actually a huge reason why I started Pursuit 365 is so that we can get the core down to the core of who we are and help each other rise and connect.
Yes.
And that is why I started it, because it's so important. It's so healing.
It's so healing. And thank you so much for what you're doing. I mean, this is incredibly powerful. And
thank you. That's very kind of you. Thank you. Thank you. Thank you. All right, Dr. King, I am going to send you off now. And I hope you have a wonderful day, the rest of your day. And I appreciate you taking the time to talk to me today. And I encourage anyone and everyone to connect with you and find out how you can help them heal.
thank you.
Thank you.